A nurse practitioner is an advanced practice registered nurse who has completed advanced coursework and clinical education beyond that required of the generalist registered nurse role. According to the International Council of Nurses, an NP advanced practice registered nurse is a registered nurse who has acquired the knowledge base, decision-making skills, and clinical competencies for expanded practice beyond that of an RN, the characteristics of which will be determined by the context in which he or she is credentialed to practice. Overview: Nurse practitioners manage acute and chronic medical conditions through comprehensive history-taking, physical exam, and the ordering of diagnostic tests and medical treatments. NPs are qualified to diagnose medical problems, order treatments, prescribe medications, and make referrals for a wide range of acute and chronic medical conditions. Depending on the state in which they practice, NPs may or may not be required to practice under the supervision of a physician. In consideration of the shortage of primary care internal medicine physicians, many states are eliminating collaborative practice agreements and NPs are able to function independently. NPSA particularly in the area of primary care internal medicine fulfill a vital need for patient health care services, and NPs work with physicians and other healthcare providers to achieve the best outcomes for patients. NPs may serve as a patient's primary healthcare provider and they may see patients of all ages depending on their specialty. NPs may also specialize in specific areas. Similar to all healthcare professions, the core philosophy of the nurse practitioner role is individualized care that focuses on a patient's medical issues as well as the effects of illness on the life of a patient and his or her family. NPs focus on prevention, wellness, and patient education. In addition to providing healthcare services, NPs may conduct research, teach, and are often active in patient advocacy activities and in the development of healthcare policy at the local, state, and national level. History: The advanced practice nursing role began to take shape in the mid-20th century United States. Nurse anesthetists and nurse midwives were established in the 1940s, followed by psychiatric nursing in 1954. The present-day concept of the APRN as a primary care provider was created in the mid-1960s, spurred on by a shortage of medical doctors. The first official training for nurse practitioners was created by Henry Silver, a physician, and Loretta Ford, a nurse, in 1965, with a vision to help balance rising healthcare costs, increase the number of healthcare providers, and correct the inefficient distribution of health resources. Scope of practice: United States. In the United States, because the profession is state-regulated, care provided by NPs varies and is limited to their education and credentials. Some nurse practitioners seek to work independently of physicians while, in other states, a collaborative agreement with a physician is required for practice. The extent of this collaborative agreement, and the role, duties, responsibilities, nursing treatments, pharmacologic recommendations, etc. again varies widely amongst states of licensure certification. Practice. The Pearson Report provides a current state-by-state breakdown of the specific duties a nurse practitioner may perform in the state. A nurse practitioner's role may include the following: medical diagnosis, treatment, evaluation, and management of a wide range of acute and chronic diseases, obtaining patient histories and conducting physical examinations, ordering and performing diagnostic studies, requesting physical therapy, occupational therapy, and other rehabilitation treatments, prescribing drugs for acute and chronic illness, providing prenatal care and family planning services, providing well child care, including screening and immunizations, providing primary and specialty care services, health maintenance care for adults, including annual physicals, providing care for patients in acute and critical care settings and long care facilities, performing or assisting in minor surgeries and procedures, counseling and educating patients on health behaviors, self-care skills, and treatment options in coordination with occupational therapists and other healthcare providers. Education, licensing, and board certification. United States. To become licensed to practice, nurse practitioners must graduate from an accredited program. The curriculum for an NP program includes courses in epidemiology, health promotion, pathophysiology, physical assessment, pharmacology, differential diagnosis and laboratory radiography diagnostics, statistics and research methods, health policy, role development and leadership, acute and chronic disease management, and clinical rotations, which varies depending on the program. The path to becoming a nurse practitioner in the United States first begins with obtaining a Bachelor of Science in Nursing and licensure as a registered nurse. Most NPs practiced in the generalist RN role for several years before transitioning into the nurse practitioner role. Becoming an NP then requires entrance into a graduate program, which is currently the entry-level degree required. NPs who graduated from a MSN program may choose to pursue the DNP in postgraduate study, which includes advanced coursework in biostatistics, research methods, quality improvement and outcome measures, care of special populations, evidence-based practice, informatics, organizational management, and a project dissertation and practicum. Some APRNs may choose to pursue the Doctor of Philosophy as a terminal degree. The PhD in nursing focuses more on nursing research and nursing education, while the DNP focuses more on clinical practice. There is currently an initiative to require the Doctor of Nursing practice as the entry-level degree for all APRN roles. Those who have an MSN but are currently practicing in an APRN role would be grandfathered into this change. New entries into the role would be required to go from the BSN directly to the DNP. Many universities have already started to phase out MSN programs in lieu of this expected change and have developed BSN, DNP programs. Nurse practitioners may also elect to complete a postgraduate residency fellowship. The majority of such programs focus on primary care. However, specialized programs also exist. After completing the required education, the nurse practitioner must pass a national board certifying exam in a specific population focus, which coincides with the type of program from which they graduated. After achieving board certification, the NP must apply for additional credentials at the state and federal level. Nurse practitioners must achieve a certain amount of continuing medical education credits and clinical practice hours in order to maintain certification and licensure. NPs are licensed through state boards of nursing. Australia. In Australia, nurse practitioners are required to be registered by the Australian Health Practitioner Regulation Agency. The Australian professional organisation is the Australian College of Nurse Practitioners. Israel and International. As of November 2013, nurse practitioners were recognized legally in Israel. The law passed on November 21, 2013. Although in the infancy stages, the Israeli Ministry of Health has already graduated 2 NP classes, in palliative care and geriatrics. The law was passed in response to a growing physician shortage in specific healthcare fields, similar to trends occurring worldwide. There are nurse practitioners in over 50 countries worldwide. Although credentials vary by country, most nurse practitioners hold at least a master's degree worldwide. Increasing need for NPs in the U.S., employment of registered nurses and nurse practitioners is expected to increase immensely in the next 10 years. Much of the growth came from a result of increase in technology, resulting in better healthcare and a greater variety of solutions for health problems. Also, life expectancy is getting longer. Therefore, more patients are living longer and living more active lives. It is further anticipated that the need for NPs will increase because of the passage of the Patient Protection and Affordable Care Act. Growth is also expected to be much faster in outpatient centers, where the patients do not stay overnight. Moreover, the increasing number of procedures that were once only able to happen in hospitals is now able to happen in physicians' offices. This is mainly because of the expansion and easy access to new and better technology, though the need for NPs is expected to be greatest in places where people have long-term illnesses such as dementia or head trauma patients that are in need extensive rehabilitation. Nurse practitioners really are becoming a growing presence, particularly in primary care, said David I. Auerbach, Ph.D., the author and a health economist at Rand Corporation. In addition, the site says that nurse practitioners are expected to double by 2025. Auerbach also told American Medical News, theory unregistered trademark essay lot of experimentation going on looking at different ways of working together, and theory unregistered trademark essay lot of interest in collaborative team-based models. The new care models, such as the patient-centered medical home and accountable care organizations, really depend on nurse practitioners and physician assistants. As a result of the PPACA, hospitals and medical care facilities are forced to rethink the demand for nurses and medical professionals. This is mainly because this new act allows millions of people the opportunity at medical attention that did not have it before, and because there are so many new people in need of medical attention, the need for medical professionals also grows. With the combination of this new act, and the aging baby boomer population, there is expected to be a large increase in the need for medical staff, especially nurse practitioners. According to a study published in American Medical News, nurse practitioners' jobs are expected to grow up to 130% from 86,000 in 2008 to 198,000 in 2025. Though there is some skepticism to these vast figures, they are backed up by many studies and the opinions of very well-known medical professionals. As a result of this extreme need for NPs, they are also expected to receive more autonomy, meaning that nurse practitioners would be able to fill the traditional primary care role like a physician would. For an example, a nurse practitioner would be able to prescribe medication without the oversight of a doctor. Many states are passing laws that allow for independent practice of nurse practitioners. Currently there are 12 states with active legislation looking at utilizing nurse practitioners at the top of their education to meet patient care needs, says Tay Kopanos with the American Association of Nurse Practitioners. Many nurses and other leaders in healthcare are advocating for overturning laws that require physicians to look over the work of NPs. See also, List of nursing credentials, clinical nurse specialist, nurse anesthetist, nurse midwife. References. External links, The Nurse Practitioner, The American Journal of Primary Healthcare, AANP Standards for NP Practice in Retail-Based Clinics, CNS and NP Practice in Canada.